Thank you so much. And Zach, if you would please lead us on.
Thank you, Scott. Thank you for the introduction. I'm actually going to take it
Oh,
first, and then
okay,
I'll
go.
turn it over to Zach. Sorry, we didn't let you know the order we would go in, but
That's all right.
anyway. So I am Aikisha Hermanson, as Scott said, and I am from PA MEDI. And I wanted to say good afternoon and thank you for that introduction and thank you for having us. I also thank you for inviting us to present today to speak about Pennsylvania Medicare Education and Decision Insight, also called PA MEDI. So our name has recently changed and it's a long name, a longer name, but it says a lot. So hopefully when you see that, you say it, you can truly recognize what it is that we do. As of July 1st, 2021, for those who may have been familiar with us before, we were a prize. And now, as I said, we're Pennsylvania Medicare Education and Decision Insight, PA MEDI. We're the same program, same services for Pennsylvania's Medicare beneficiaries, now with a new name. Next slide, please. For those not familiar with us, you are probably still wondering what is PA MEDI? PA MEDI, formerly called a prize, is the name of Pennsylvania's state health insurance assistance program, otherwise known as a SHIP. So when you hear that statement, you may think, as Scott was mentioning, wow, that sounds very similar to, what you guys do as a sister. So hopefully our plan by this end of this presentation is you really understand how we work together, how we can work together to help those in Pennsylvania, and how we differ, why we differ, and how you can use us as a resource. So just there, I emphasize Pennsylvania because these SHIP programs are established in all of the states, the different states here. So in Pennsylvania, we're PA MEDI. I think as I'm learning about the different states, like Florida is called Shine. And then some states do just call themselves, that state SHIP, like Nebraska SHIP, I believe they called. Okay. Then, sorry, I got an alert that my network was bad quality. So, Scott, I can see you if you happen to lose me. Okay, thank you. All right, moving on. PA MEDI is largely federally funded, but we also receive Pennsylvania lottery funding, which is very helpful to us, reaching our mission. To ensure that services are available to all Medicare beneficiaries across PA, the funding goes to 52 local area agencies on aging, or AAAs, to deliver those services in the community. So, of course, we have more than 52 counties here, but a few of the offices combine and reach out to three or four of those counties at a time. So that's why the number is lower. PA MEDI staff working in these agencies are supported by volunteers, and there are over 600 volunteers statewide that contribute their time and talents to the program. That's a large volunteer network, but we are always looking for more. So I'm going to always bring that up. If anyone has any spare time interested in volunteering, or may know someone once you hear the whole presentation today and get to know us more who may be interested in volunteering in different capacities, please, you'll get our website at the end. Please ask them to sign up. And the next slide, I will discuss more about our organizational structure. Okay. The For those not familiar, or excuse me, now that you know a little bit more about our program, let's talk about how it's structured. At the Pennsylvania Department of Aging, there is a statewide coordinator. That is me. From there, we have 4 regional coordinators. Zach is one of 4, and he is in the southeastern region. That was my quiz. Hopefully, I got that right. If not, when Zach comes on to talk, he can correct me for sure. And the regional coordinators are either with a local AAA or subcontracted through another organization, but they all do fantastic work for our state and help align the local programs along with me here at the state level. As I mentioned earlier, PA MEDI services are typically delivered through the AAAs, and they use both paid and volunteer team members. So on the chart, that's where you see, all of us. We're all paid, the statewide coordinator, regional coordinator, and local program staff. And then, of course, we have the volunteer team members. In some counties, the AAA has subcontracted, as I mentioned before, but regardless of who hosts the program, services are delivered in the same manner. Each logo program provides face to face counseling, telephone counseling for simpler situations, or even counseling via email. Due to COVID, many of our local programs have also incorporated virtual counseling. So we're using all types of platforms to ensure that we continue to reach our beneficiaries out there. For optimum services, beneficiaries should call first to make an appointment, especially if they're comfortable with in person. A lot of our offices have opened up again, but we will take walk ins if they don't set an appointment. In addition to the counseling services at the local level, so each county level, PA MEDI also operates a helpline that can serve as a point of contact or referral for the Medicare beneficiaries. Our helpline can be reached at a toll-free number, which will be provided at the end of this presentation. So you'll be able to jot that down. That will be one of the most important resources for you guys. As you learn about the program, you may have people call in asking about Medicare. That helpline operates from Monday through Friday, 8 to 5. And they can provide basic Medicare information. So this is explained to them when they call, but just so you guys know, the helpline, they aren't the certified trained counselors like the local program staff or regional counselors, or excuse me, regional coordinators, and soon, myself. They are there, they have basic knowledge of Medicare, but what they primarily do is refer them to then a local program staff who can counsel them more in depth. I also want to mention that when a beneficiary calls or comes in for assistance, the PA MEDI counselor may become aware of other issues or needs outside of the scope of our service. But what's cool is our counselors can provide a referral to other needed agencies or services such as LIHEAP or SNAP. So we really try to get them the help that they need if they're interested, even if it's not Medicare related. From here, I will now turn it over to Zach, who will give you even more specific information about PA MEDI.
Thanks, Akeisha. Hi, everyone. My name is Zach Valentine. So I'm, yes, the Southeast Regional Coordinator. I cover South Central Capital Area and over towards Philly. So as far as who seeks our services, it's a wide range of individuals. We obviously deal with Medicare. So Medicare eligible individuals would be people nearing the age of 65 or people who have been on Social Security disability benefits for 2 years. So we're helping those individuals, certainly their spouses or other family members who may be there to help interpret the information, caregivers. It's tough to handle. I know lots of times when there's a couple, sometimes the one individual is the decision maker in the two. But we also deal with dual eligible folks who have Medicare and Medicaid. So they work in conjunction and we help them with their options, but we're not going to turn anybody away. But we certainly see a wide variety of individuals that come into our offices. And so the basic premise of our program is to provide that health insurance counseling. If there is anything that we can do, it is provide this free, confidential, unbiased health insurance counseling, just like you guys do with the marketplace. So this is on Medicare and what it covers, eligibility, Medicare supplement policies, Advantage plans, drug plans, the whole gamut of it. And as Aikisha mentioned, it can be in multiple forms. So over the phone, through virtual platforms like Teams or Zoom. In person is usually recommended just because it's easier to, I think, for a lot of older individuals to learn face to face. Along with that, there is the community education aspect. So just like we're doing today, presenting, we do give presentations to professional partners. And then more so at the local level, we provide presentations to the public. And the most popular version of that would be a Medicare 101 or pre-retiree event that helps prepare people for what's coming up. So if they call a few months ahead of time and there's a presentation available, we'll get them in and it gives them basic Medicare information, again, on coverage, eligibility, enrollment, the other options available to them. Really gets them thinking because there's just so much information with Medicare. It's overwhelming. So if we can at least break it into multiple sessions, that we give them a presentation with the basics, they go home, they think about the info, they think about their situation, they come back to us for an appointment, they're much more prepared to make a decision. There might be other presentations we can give to, so that could be Medicare updates. Every year there might be new benefits or plans are always changing year to year, or more in-depth presentations, or just general who we are. And that kind of speaks to the outreach piece, that we're always trying to get our message out there. We're always not in direct competition with agents and brokers, but certainly we want to try to, keep our business. And there's plenty of business in Pennsylvania. There's over 2 million Medicare beneficiaries here in this state. So plenty to go around, but we're always trying to get the message out there, and would love to see referrals from your group if you come across Medicare eligible individuals. And so how do we help people? Well, again, we provide that free, unbiased, personalized counseling regarding all of their options. With that, we're interpreting Medicare rules, looking at policy. When it's not open enrollment time, that can be what some of the cases are about. It's these oddball cases where we're trying to decide, should this have been a covered service? Can they make a switch to their plan right now? So we're really digging in to Medicare policy, to Social Security rules, since they're the gatekeepers of Medicare enrollment, to help individuals. And kind of along that line, we address coordination of benefit issues. There's a plethora of other insurance options out there, and the trend is people are working longer and working into their Medicare eligible years. So they are looking at potentially delaying pieces of Medicare until they're ready to retire. And so there are coordination of benefit rules between Medicare and employer group health plans that we have to be aware of and inform individuals about. But there also might be other insurances out there. If there's the retiree coverage, if they're offered that once they leave, there's veterans health insurance such as TRICARE, TRICARE for Life, or the VA. Medicaid is another popular one. There's tons of things out there that we always have to be learning about. We help individuals with public programs. So there's a few main assistance programs that help individuals with their Medicare costs. So if you've ever heard of PACE or PACE-Net, the Extra Help Program through Social Security, or the Medicare Savings Programs / Medicaid, those are our main categories that we're making sure everybody who walks through our door is screened for the assistance they might qualify for. We assist with plan enrollments, so we can actually enroll individuals into Medicare Advantage plans or prescription drug plans. And that is a bulk of our work here during open enrollment, is helping review coverage and enroll if the person is comfortable at that time. And we can assist with filing appeals. So appeals could come for numerous reasons: denial of coverage, they're being sent home from the hospital, and the patient thinks it's too early. Could be enrollment decisions. Maybe mom got kicked off the plan because she forgot to pay her bill, so we have to work through trying to get her reinstated. Again, coming into those oddball scenarios, but that is within our scope to assist with. And so the best way to reach us, again, is there's kind of multiple ways. The PA MEDI helpline is that state helpline that if you're unsure of, if you don't have a local contact to refer to, that state helpline will get them to the place they need to go. And we have a state helpline just because nationally it's an easy number to give out. But I will send Scott a list of local program contacts that he can pass around, that you can find your county. It'll have their address and their phone number that you can give to a beneficiary if they come into your contact, and they should receive our help instead. And so we also have our website. It's under the Department of Aging's site. It's just our PA MEDI page on there. It gives info about us. It has a link for a aging office locator, has a link for our events that are available to the public, amongst other things. So I know open enrollment's coming up. Our open enrollment is October 15th through December 7th. It overlaps with yours. We've done events before together with the insurance department also involved, just because we know sometimes there's overlap, whether people confuse the enrollment periods, or maybe a spouse needs help with Medicare and the other needs help with the marketplace. So yes, if once the local contact info goes out, we'd be happy to have local referrals. Or if you want to actually get in contact with the specific staff at that site, we can certainly make that happen too. So again, appreciate everyone's time to quickly learn about us. Certainly open the floor now for any questions that may have not been answered already.
Absolutely. And thank you, Zach. Akeisha, thank you so very much. Akeisha's been working diligently in the chat to sort of keep up with the questions as they come in. If you'd like to go ahead and address any of the questions in the chat, please feel free. If you feel your question hasn't been answered, unmute yourself and ask a question, or you can drop it in the chat. Believe me, this is a big subject. And it's one that I was very happy to be able to connect our sister network with, because there are a lot of, let's face it, there are a lot of questions that come in from individuals as we work through the communities about the interface and the difference between, you know, getting insured through Penny or health insurance options as people do enter into a scenario where they're eligible for Medicare options. And as Zach and Akeisha both pointed out, Medicare options are vast. It's like looking at Orion's arm in the night sky. It is a big topic. So if you have questions, now is the time to ask. I do see that the majority of the questions that have been coming through have been resource based and how to, and again, it's, you know, incredibly important. Any resources that are shared with me after the fact, believe me, I will make sure that they get to all of you. But if you have questions, let's try and ask them while they're here with us, okay?
All right, thank you. Thanks again, Zach, for finishing up the presentation. I was answering the questions in the chat as Zach was talking, but let me just look at this again. I know there was one I said I would finish and answer live, I guess. So the helpline information is on the screen, so you guys have that, the hours, and I will remember that for future slides. And when I send it to Scott, to put the hours of operation on there for you guys. And I will provide those slides to Scott, along with Zach has a resource as well to contact local programs. if that seems to be able to make more sense. Because remember, from my part of the presentation, I mentioned that the helpline, they are very knowledgeable about our program and have knowledge about Medicare, right? But when we get into those nuanced cases, when people have specific questions, they want to change their plan, et cetera, as Zach was explaining why they come to us, the helpline is going to always refer them to a local program. So for you guys, when you're talking to them, if you want to use, the local number, then you can. If for some reason they don't get a call back, or it's difficult to get through to the local program, then the helpline is always a reference, and they are open Monday through Friday from 8 a.m. to 5 p.m. Okay, so then the other thing that was in the chat there was the question about becoming a Medicare counselor. So I did answer that in the chat, but just in case you weren't able to keep your eye on it while listening, that to me, my understanding of our programs, meaning Penny program and the PA MEDI program, is it will likely be a duplication or overlap of assistance or services if you're ever interested, if you guys were to become Medicare counselors. So that opportunity is more so for those who are looking to volunteer at that versus us as state employees. So if you want any more Medicare information, the website that is on the screen is there. We do have some resources there. And it was more so like for anybody interested in volunteering outside of here. But we also have other roles if you were interested in volunteering. So as far as being certified as a penny assister, that will probably be a duplication, so we wouldn't be able to do that. But you guys met us, you have the contact information. Please reach out for sure. And then the Pamela's question: does every local AAA have a PA MEDI services on site? So the answer is technically yes, technically no. So the reason why it's technically no is because, and Zach, jump in and save me here, but there are some areas where the counties are combined. Okay, so in those areas, you might not find someone in every single office because they're at Blair County, for example. So let Zach jump in so he can give those specific examples, because that's a very good question.
Yeah, so some aging offices are multi-county. So, for instance, Union and Snyder are together, Columbia, Montour. We have up in the north, Bradford, Susquehanna, Sullivan, and Tioga counties are all together. Also, there are some AAAs who have decided to subcontract the program out to another public entity, such as United Way, RSVP, or another type of aging service provider. So the AAA, the aging office, should know who to refer to if they don't directly house the program. As
Thank you.
far as as far as other things in here, our open enrollment date again is October 15th through December 7th. That allows individuals to join, switch, or drop a Medicare Advantage plan or a prescription drug plan. It has nothing to do with Medicaid. That can be applied for at any time. And then the website for assisting someone in applying for Medicare, if we're talking about just original Medicare, the A and B, the red, white, and blue card, they would have to apply through Social Security, and that would be through like a My Social Security account, SSA.gov, if not calling the local Social Security office. And then if we're talking like other plans, potentially that might be through Medicare.gov, or the supplement policies, for instance, actually have to go through the company or a broker. So all depends on which part of Medicare we're talking about.
Perfect. Thank you. Pamela, you can add in the chat, or if you want to unmute, just to make sure going back to your question, that we answered that. It's probably not that confusing, but I just don't want anybody to think that we don't serve, like 15 or whatever counties. We do serve them all. So if you need any more clarification on that particular question, just let us know. But it looks like we answered everything currently in the chat, and I don't see any hands raised or anyone off mute. Is that for us?
All right, excellent. And Akeisha, Zach, thank you again so very much. And thank you to everyone for taking time. Jennifer, do you have a question?
Hi, yes, I do. So I did ask, I'm sorry if I missed it. The open enrollment is for Medicare and Medicaid, October 15th to December 7th. I just wanted to clarify.
Yeah, the open enrollment for October 15th through December 7th is the open enrollment for Medicare Advantage plans and prescription drug plans.
Okay.
Origin
Medicare Advantage. Okay.
Yes, and prescription drug plans, which if you're on Medicare and like fully into the Medicare realm, most people have one of those two that they need to review. So original Medicare, the A and B, that has other time frames related to each individual. But yes, Advantage plans and drug plans. Medicaid is separate. That can be applied for at any time and has to be renewed usually on a yearly basis. So that has no set time throughout the year.
Nope.
Okay.
And while we
Thank
know
you.
about Medicaid, I can comfortably say we have nothing to do with that. We help people if they need to be steered that way, but we're Medicare, Medicare, Medicare. So thank you for that question. Bring that up.
All right, everyone.
Yeah.
Yeah,
So,
we are. Yeah, go ahead.
Scott, I don't know. I couldn't see emails, but is everybody on the line then state employees as
No,
well?
actually,
Oh, that's right.
this is part of, in fact, everybody on this call is part of Penny's Assister Network. So these are individuals that serve as registered assisters across the Commonwealth of Pennsylvania. They work everywhere from hospitals, health centers, to faith-based organizations, community-based organizations, and they are quite literally a vital backbone for Penny and its success here in the Commonwealth of Pennsylvania. They help get people protected, period. So it's, I was so happy to be able to introduce the two of you. Thank you both for taking the time to be with us today. Once this recording is polished up, I will make sure that it's sent out along with the resources to our sister organization. Akeisha, Zachary, thank you so much. You have a very peaceful afternoon. Everybody, thank you. Be safe and